All right, we are back with our sponsor from Arkansas Surgical Hospital, and we are happy to have orthopedic surgeon Dr. Joel Smith with Arkansas Surgical Hospital here to talk a little bit about shoulder and knee joints and what they can do to fix you up, right?
Yes, ma'am.
Welcome. Good to have you here. Let's talk a little bit about 1 week from today. It's a great opportunity for people to ask questions and get answers, right?
Absolutely. Social media has really changed, I guess, everything, and this is a great tool for us to be able to reach a lot of people at one time to answer their questions, because you know everybody goes down that Google search and comes in thinking that they're dying.
Right, yeah.
This is a way that they can get real information, talk to a real doctor, and get some questions answered without knowing whether or not it's really accurate or not.
Right, yeah, and we're going to talk about how to log on and how to be there 1 week from today. But let's talk about some of the common ailments. We're talking knees and shoulders, which you see a lot.
Yes,
right?
ma'am. Mostly that's what we're going to talk about. But we can discuss anything, but shoulder and knee, very common, and from youth all the way through adult, and from weekend warriors and playing sports and getting bumps and bruises, and just general, as we get older, tendonitis and bursitis.
Yeah, exactly. And you hear a lot about hips as well, especially as we get older,
Yes.
that the hip joints are problems. So what are some of the treatments that you have? Is it always surgery, or are there other things first?
Most of the time, surgery, at least for me, is a last resort option. If there's something that we can do to get you better, I always think a non-surgical route is the best way. You can always try over-the-counter medicines. You can do, now where the internet might be good is it can show you some general stretching and some exercises you could do on your own just to try to kind of get over it. And if that doesn't work, then come in and let us evaluate you. And then, again, I think most of the time, probably 80–90% of the things we see, we can get better without any actual surgical intervention.
There are injections and a lot of things that can really maybe put surgery off at least.
Injections, physical therapy. There's a lot of modalities that we have that these days that can help people stay active but stay out of the operating room as well.
Yeah, and if you are active, you want to get back active as soon as possible, and it's a lot less downtime now than it used to be, right?
Getting a lot faster. A lot of our rehab protocols are quicker these days, and a lot of the medicines that we have to use will help people recover a little bit faster, but it still takes the body a while to heal and get back to 100%.
Yeah, a lot of times it does take a little while, but you'll see people up and around, headed back to work or back into their normal lives very quickly. Talk a little bit about, you're with Martin Orthopedics and sort of the cooperation with Arkansas Surgical Hospital.
Well, I'm with, there's a few of us doctors and physician assistants with Martin Orthopedics. We have 2 locations, North Little Rock and Little Rock. I work primarily out of North Little Rock, and we do the vast majority of our surgeries at the surgical hospital, and it's just a wonderful facility for patients that eventually get to the point of needing to have surgery.
Right, yeah, because you can operate many places. Why do you choose there? Why is that the right place?
I think for me, it's the staff. You have a very qualified staff that all they do day in and day out is orthopedics and spine surgery, and so you have from the pre-op nurses all the way through your entire stay at the hospital, all you have is people taking care of orthopedic patients and spine patients, and not other patients that have pneumonia or other ailments, and they're all just focused on your recovery.
They specialize in what you're having done, which is great to know, because they've seen it all before you probably. All right, let's talk again about 1 week from today and kind of how that's going to work. Are you just going to sit there and let the questions come in on Facebook?
Yeah, usually we get some questions generated before the event, and so that way we have something to start with, but be happy to entertain any questions that people want to send in while we're doing it. We're going to try to do it at noon. I'm going to do it in between surgery, so it's going to be interesting how to make that work. But there's usually some downtime in between surgeries while they're getting things ready for the next one. So we're going to try to do a Facebook Live. We're going to do it out of a patient room so people can actually see what the inside of a room looks like at the hospital. And so I think it'll just be an excellent opportunity for everybody to try to get some questions answered, and hopefully either avoid the confusion of the internet, and maybe even avoid getting to come into the doctor's office to ask a question that might be able to be answered online.
It might save you a trip in to find out what you need. So you can get to it from, I believe, your Facebook page, right?
You can get there from our Facebook page. You can get there from the Arkansas Surgical Hospital's Facebook page, and
It's at lunchtime, so
At
I mean,
lunchtime
you
on
can do
Monday,
it. You
at
can do it
noon.
on your lunch hour, right? Or if
That's
you're
it.
retired, you've got time, hopefully, to join in and find some great answers to some of the questions you may have about joint pain, which I think we're all eventually going to have something going on,
Each
right?
year I get older, it gets a little
I
bit
agree.
more. So I
Exactly.
it's
Our
gonna keep
veteran
on.
who was just here said, I could be one of your patients. He's
Absolutely.
had many issues, but he's been fixed up by doctors like yourself. Thank you so much.
Thanks for having us.
Good luck Monday.
Thank you.
It'll be a lot of fun
It'll
and
be
very
fun.
informative as well. Okay, back in just a moment, we're going to visit with